We protect lives by helping people and business owners understand what is at risk here, what they're dealing with.
I had the expertise and I wanted to help. So, that's why I got into industrial hygiene in the first place.
And that means a lot to the profession, and it means a lot to AIHA.
AIHA and its members live and breathe the mission to ensure workers return home healthy to their families.
This is a profession that gives back to society. You are literally saving lives in the workplace.
That's what an industrial hygienist does. They're for worker health and safety, but on the larger scale, they're there for community health and safety.
AIHA seized the opportunity to prove its impact in 2020 when the world went into lockdown.
One thing industrial hygienists are known for is we step up in emergency situations. And on one evening, April 22nd, I'm watching the late news and I saw Mark Cuban on the news, and that he also was on the White House task force for reopening America. And it hit me. I sent him an email explaining industrial hygiene and AIHA and how we could help in this situation. And it was literally 11:30 at night, 20 minutes after I sent the note, Mr. Cuban responded to me with, "What do you have in mind?"
Following this communication, Alan Flieger approached AIHA leadership to create the Back to Work Safely Task Force with the goal of creating practical guidance to help small businesses reopen safely.
We knew that we had a responsibility to step up and take a leadership role. Literally within weeks of everything closing down, we formed the Back to Work Safely Task Force.
And I heard about this effort for the Back to Work Safely documents, and I wanted to be involved. I was more so thinking about how can I help people? How can I help the individuals who have to go into work every day?
Members produced guidance for 27 industry sectors.
I was involved in the transit systems guidance document. We used the hierarchy of controls. That's mainly how the science kind of came into it, and making sure that there were layers of mitigation risk strategies available for business owners and employees.
And it provides practical guidance based on those levels of hierarchy of controls to a business owner who is not science-minded.
Essentially, you're able to get communities together safely.
And within 3 weeks, we published 20 different Back to Work Safely guidance documents. We developed materials for restaurants and bars, hair and nail salons, gyms, and childcare facilities.
AIHA sent Cuban the first of the Back to Work Safely guidelines.
He absolutely loved it. He said, "This is exactly what we needed." Week after I'd sent Mr. Cuban the first one, I get an email from a senior staff from the White House saying, "We've been watching what you do. We really like what AIHA is doing." Mr. Cuban started posting about this information, and then all of a sudden you just saw the ripple effect, if you will, of the number of downloads of these documents.
And over the lifespan of Back to Work Safely, the documents were downloaded close to 2 million times. The Back to Work Safely initiative is one of the most seminal accomplishments of AIHA.
I am absolutely proud of the work that I did on the Back to Work Safely Task Force, and everybody volunteered their time.
Balancing personal concerns with professional needs.
Definitely bridging your personal life to your professional life. It's something that we do as industrial hygienists every day.
AIHA expanded its reach.
AIHA and IBEC became strong partners at that point in time. Industrial hygienists are trained risk assessors. I had no doubts about the scientific validity of what was being produced.
Further validation stems from the economic impact of helping revive the economy.
If you don't have any people to work, that's a huge economic impact. And that's why I love the document so much, because it was on point. Many of the knowledge products that we created came from a grant that AIHA received from CDC.
From that funding, we developed a series of knowledge products, and all of that material is located on committocare.org.
It's going to have an impact far into the future, what we do. But we wanted to make Commit to Care more evergreen. That's what we're trying to do moving forward with Commit to Care, is be more embracing of the next emerging infectious disease issue. This is not the last pandemic. It's trying to put risk assessment tools in the hands of managers and business owners so they can begin to do this on their own, to protect the workforce, to protect those that actually make our community, our system work.
And so I think the legacy of Back to Work Safely is that it basically transitioned into the Commit to Care initiative. And the Commit to Care initiative is now all about indoor air quality, and that is the new normal. Back to Work Safely and Commit to Care has enabled AIHA members to really step out of their conventional space and position themselves as thought leaders and communicators to the communities where the workers are.
The impact felt large to me because my family felt safe. My friends felt safe.